views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any entities they represent.
Hi there, and welcome back to Code Lavender, the podcast.
We see. No, we're not even on you now.
I know, you're
we're
like jumping the gun.
we're not even on you now.
Who do we want to be on?
He wanted me to talk first.
Oh, well, all right. Go ahead, Dr. Ashley.
Yes, well, welcome to Code Lavender. And I'm Dr. Ashley, professor, clinician, and your unofficial chief of emotional triage.
And I'm Nurse Tanya, your favorite optical nurse.
Yeah.
So today we are honoring Veterans Day with a special episode that reminds us that caring for others, especially in crises, has always been at the heart of nursing and medicine.
And I am really excited. We have a special guest today who really lives up to that mission every day. I want to take a minute to introduce probably my best friend in the whole world, Dr. Christopher Norris.
Wait, I thought I was your best friend.
On
right? I don't know.
Once a month on a Saturday.
All right. Okay.
Oh.
I guess we have to do another show this month to get your day in.
Dr. Norris actually has over a decade of experience in emergency medicine and in pre-hospital care, from academic hospitals to the front lines of EMS operations. Welcome to Code Lavender, Dr. Norris.
Thanks so much. I appreciate it. Thanks for having me.
And I am actually excited to share that although I am very sad that Dr. Norris left us in the New Jersey, New York area, he is serving the local community here in the Phillipsburg area. And he is, I'm going to let you tell them exactly what you do, but he's at St. Luke's system, and he is doing some awesome stuff there with the EMS fellowship and air medicine and emergency medicine. So what do you actually do?
Okay. Yeah. So I have a lot of hats. And, again, I am really grateful to be here. Most of what I do and what I originally started doing with St. Luke's was just clinical emergency medicine working. I usually work at St. Luke's Anderson or St. Luke's Easton hospitals. But I occasionally will make my way all the way up from like St. Luke's Monroe to over here in Phillipsburg. We have St. Luke's Warren and down Allentown. But 2 or 3 years ago, I started as medical director for St. Luke's Emergency Transport Services. We are now the largest EMS agency in Eastern Pennsylvania. And we have many different locations, stations, all the way up from up in East Stroudsburg and Monroe, all the way down to like Quakertown. And as of this last Monday, we actually, we're going to start serving the area around Upper Bucks as well. So we are managing Upper Bucks and then everything in between. I also I teach an EMS fellowship, so I'm a core faculty for St. Luke's EMS fellowship. And we currently have one EMS fellow, Mike Murphy. He's a wonderful guy. If you get to see him on the streets, he's absolutely a joy to work with. So I do that. And what else do I do? I occasionally do flight medicine still. So I'll fly people all over the world.
So not very much then.
No. And I think it's really important to just put it out there that Dr. Norris also is a pilot and owns a plane, and sometimes he tries to kill me. It's a lot of fun.
I do. I've got a little Piper Arrow. We'll fly around. Everybody's got to have a hobby. So.
It's kind of cool to go to like the Catskills for dinner and hang out.
Yeah, last week, where'd I go? I went to New Haven, Connecticut. We had dinner out there. So that was nice.
Oh, what a horrible
The best pizza in the world. New Haven.
Right? That was actually our goal.
For real?
She was great. Apparently.
Yeah.
I mean,
it's the pizza capital. Ask Portnoy. Yes, it is.
I was going to say I'm a little partial in New York. I love myself a good New York pizza, but New Haven's good too.
All right. So today, let's start at the beginning. We're going to talk about military medicine, which I think Chris is another awesome person to bring here. He's ex-Army or Army. I don't know if it's in.
No,
we're going to talk about nursing. And we know that started long before our modern day healthcare, from the Crusades and many other wars. Caring on the battlefield really kind of shaped how we define care under pressure. And we learn every step of the way, and we kind of modify what we do.
So very true. But, you got to kind of picture it in the 1850s with tents filled with wounded soldiers, no electricity, no antibiotics. And in walks Florence Nightingale, our hero, with a lamp and a mission. And she transformed chaos into a system of hygiene, order, and compassion, Ashley.
Yes. So Florence Nightingale is my hero. And I always tell people, and the reason why is she is the first person in healthcare of any discipline at all that actually recorded statistics and tracked data.
Yes.
And from that, she recognized what contributed to infection. And she also kept it nursey, stayed holistic, and she realized people need light and they need conversation and they need companionship and they need care at night, not just during the day. So I think she's a really, really important person. And she is truly credited across all disciplines with being the founder of evidence-based practice. So you go, Florence.
Yeah, she's among other things. I mean, we could talk for hours about what she, how medicine has just really, the whole situation with TB was sort of figured out by
nurses in Staten Island, actually.
Yeah, by our girls. But I mean, her legacy certainly still lives on, Ashley, from World War I and World War II field hospitals to today's combat medics and military nurses. The battlefield became the birthplace of trauma systems, actually. And I know you have plenty to talk about with that, as does Dr. Norris. Triage and teamwork that we now see in every ER and trauma bay.
Yeah, so I think, Chris, Dr. Norris, what do you think as far as modern day trauma medicine, field medicine? How do you think in the civilian world we've borrowed tactics and care traits from the military to innovate in how we triage patients? What you do with air flight medicine or ground and just stabilizing in the field. I know you and I worked a lot on a publication about what happens. Do you, stay and play or tow and go? What's better for the patient? So what can you tell us? What do you think?
Yeah. So, a lot of this, and you're right, that publication should be coming out soon.
When?
Yeah, I know. Seriously. Actually, next month. All right. Hopefully I'll keep you posted. But it is really important to really think that, modern triage is essentially the idea of taking care of the sickest patients first, because if you can take care of the sickest patients first, you can save the most lives. So it really is truly about, doing the best for the most number of people possible with the resources you have available. In reality, we did borrow a whole lot of that from military medicine. The other thing that's been really important is, I am specifically very passionate about flight medicine. And we began to actually see flight medicine being used in a military setting. The first actual medical flights were when they literally would just shove patients into the back kind of storage compartments of old World War I planes. And they didn't actually start using helicopters for military transport until, in the Korean Wars. But it really picked up. And of course, in Vietnam, medevac became a huge, huge thing. And we didn't really start doing that as far as taking the military medevac sort of mentality and using it in the civilian world until like the very late 1960s, 1970s with shock trauma down in Maryland, when they actually started using helicopters to deal with traumatically injured patients on the streets, because they realized that we have a lot of trauma in America in the civilian setting, and why aren't we borrowing some of those like military, like wins for our civilian population? And we started doing that in the 1970s. They came out with the white paper for EMS, which was a huge paper. It was, accidental death and disability, and it was the hidden disease in America. And it was all about the fact that a huge amount of the American population was dying every year from car accidents, which from that paper, they presented that paper to Congress, and Congress said, we need somebody to do something about this, because before then, civilian trauma care was pretty, utilitarian. It's very, very, disorganized. Mm-hmm. And they said, okay, we need to take this problem. We need to actually do something about this. And because it was all car accidents was really their main focus at that time, it actually was put under the Department of Transportation. And so EMS actually to this day is still managed by the Department of Transportation.
Oh my God,
and not under
so
the Department of Health and
interesting.
Human Services, which you would think is, what it should be. Although the Department of Health and Human Services is now taking a more active role in EMS, management and all that. But Yeah, we still actually do everything underneath Department of Transportation.
It's so interesting because I think that so many of us just take it as a part of regular modern medicine, but that's not like that's really modern. The late 60s. That
Yep.
seems staggeringly recent
Yeah.
to me. But
Yeah.
I'm old, but I
Well,
mean, that doesn't
you
seem
remember
like
back
a
in the 1960s.
yeah.
Wait,
like
how,
that just-
how old are you?
older?
I just turned 50.
I
But
know. Thanks, Mom.
double nickels. Holy.
Thanks, Mom.
Oh, shit.
But that is really interesting that the genesis of it was with in the military, and then it all had began with traffic crashes.
Yeah, absolutely. And it was funny, like in the early 70s, because this whole idea of having like ambulances, well, and we still had ambulances even long ago, but the idea of having like EMTs and paramedics and actual EMS agencies and all that was so new that there was a lot of wild things that would go on. Multiple EMS agencies showing up at the same calls and literally stealing patients from each other, like out of the back of the ambulances, racing to hospitals to try to see if somebody could get paid for what they were actually doing. And it was just Wild West.
Oh, wow.
So,
I think there's a TV series in there.
They already did it.
They did?
Yeah.
Good.
Have you ever seen Mother Jugs and Speed?
No.
So Mother Jugs and Speed was a fantastic movie that came
Probably
out.
not if you watched it and are reading it. Fantastic.
Yeah, and I'll be honest, it depends on how you feel about Bill Cosby, but he was actually one of the main characters in it. So not great these days. He kind of canceled himself.
TV's TV.
Yeah, exactly. But it's a great movie about just the kind of the Wild West days of EMS. And
I was
Mother
I'm gonna
Jugs
watch
and
that.
Mother
what?
Jugs and Speed.
I'm gonna
Yep.
watch that.
Huh.
Yeah,
Wow.
no, it's good. Yeah, absolutely. So also had Raquel Welch, and she was Jugs, that was the 70s for you, I guess.
I
Yeah.
guess it was. It's kind of wild to think that everything from helicopter evacuations to trauma alerts can be traced back to those battlefield origins, though. I think Florence would definitely approve of the organized chaos that we call the ER. What do you think, Ashley?
She'd probably have a clipboard out. She'd be writing some things down. She'd be telling people to wash their hands.
Look, there's never too many times to wash the hands.
Yeah.
All right. So speaking of battlefield medicine and kind of like piggybacking off of what you're talking about, Chris, everybody kind of talks about the golden hour and then that platinum 5 minutes.
Mhm.
So,
Yeah. The golden hour, which originated in Vietnam, Colonel R. Adams Cowley, often called the father of trauma
That's right.
medicine. Yeah. Notice that the soldiers who got definitive care, surgery, transfusion, stabilization within 1 hour of injury were far more likely to survive.
Yep, absolutely. I mean, Dr. Cowley is actually who started shock trauma in Maryland, and he actually was the guy who had the first civilian helicopter. But he, along with one of his colleagues, wrote another very seminal paper about this idea of the golden hour.
Yeah.
And that
I think we cited his in our work.
Totally
in
did.
our
As a matter of fact,
research,
it was in our
yes.
very first paragraph.
I know. I know. Go Dr. Cowley.
Yeah, right. But yeah, he really did. He ended up from a military and a civilian side. He kind of standardized trauma, care.
Yeah.
And all that.
Well, and that insight, it really did change everything. It led to MASH units and surgical teams in the field and kind of modern combat pop-up hospitals and things like that. And this was all just really in an effort to bring really acute advanced care closer to the battlefield and kind of look at what does that time frame mean after injury? Like what is necessary to have the best outcome?
I mean, it's that platinum 5 minutes, right? The first few minutes after the injury are the make or break window, to my understanding. Is that correct? I mean, when the medics or even fellow soldiers have to act fast to stop the bleeding, open airways, or prevent the shock.
Yeah, absolutely. In reality, the platinum 5 is a little bit more of a newcomer, ideal than the golden hour. But
Right.
really, what we found, especially with modern combat, and with a lot of our modern combat sort of mentalities and teachings like TCCC, the Tactical Combat Casualty Care, they've really found that all of the major devastating injuries that kills patients that are traumatically injured,
Mhm.
many of them, if there is the possibility of making a change with that, it's treating immediate life threats. So you get into your stop the bleed programs, and you get into your they recently changed kind of our whole triage system to go from being like, you manage your ABCs, airway, breathing, circulation, to actually looking at controlling massive bleeding first. Either March, if you're in the military, that's their acronym, or us, we started with going to CABC or XABC, like control exsanguination, and then check airway, breathing, circulation. Because everything from managing airways, if somebody's lost their airway, helping to give rescue breaths, helping to apply direct pressure and tourniquets, those things actually in the first 5 minutes of an injury, that Platinum 5 can actually save a huge amount of lives.
It's so interesting to actually see it being deployed in reality rather than just reading about it in theory.
And what do you think about, because this has changed in my career, and it's changed, I feel, recently. Like, we have really evolved and, changed everything we thought was perfectly right is now not the answer. And this is medicine. But what do you think the biggest challenge is when we're looking at applying that military speed and trying to get to that level of precision in this civilian situation that we're working in?
I mean, we still try to see if we can get people to definitive trauma care centers within an hour. And a lot of times if a patient walks in, we've had people that come in with gunshot wounds, even at Easton Hospital, which Easton Hospital just got their trauma 4 accreditation. But for years when I was working there, they had no trauma accreditation at all, but we'd still have people coming in. They'd been shot. And the idea is like, you need to get this person to a trauma surgeon, because a lot of times and God love my EMTs and paramedics, but they don't need an EMT or paramedic. They don't even need an ER doc. They need a trauma surgeon who can take them to a trauma OR to actually do things like, open them up and see if they've actually had damage to their internal organs. And so for us to do whatever we can to, as quickly as possible, get these guys to the correct, trauma care, can save a huge amount of lives. And there's a ton of data, 19 papers that I found specifically that addresses that issue and really does find, that is the case. Weirdly enough, though, they did find in a few papers that if you bring the physician to the actual injured patients, a lot of times you do have better outcomes with physician-led care in the field. So a plug for myself, being an EMS doc, is going out and being a doc in the field is also shown to have some pretty good benefits.
Yeah. Well, and I think just from our conversations, and you're telling me what you're doing, and I think one of the coolest things that they're doing, and you're going to love this, they carry whole blood on the rigs, and they can give blood in the field. And logistically, when he told me that, I'm like,
That's
oh, bullshit. And I'm like, there's no possible way you can sustain that financially and from a, operational, but they're doing it. So I think, residents of this area of Pennsylvania might live.
Yeah.
They have a chance out there.
It's
so
incredible.
we, a couple of years ago, when Pennsylvania actually changed their state protocols to allow for EMS providers to give blood pre-hospitally, it was funny because so many different hospital networks, from Tower to Lehigh Valley to St. Luke's and all that, we really looked, and even a lot of the your little EMS agencies, your kind of small regional agencies, were like, is this feasible? Can we actually make this happen? And what we found was that logistically, it's a huge undertaking, because you have to have a distributor for blood. You have to have, we use Miller Keystone, but the Red Cross is another one that uses, they supply a lot of blood. And then you have to have a blood bank to manage that. And you have to have all of the coolers, and you have to have blood warmers, and you have to have, all this other supplies. And then blood itself is a rather expensive sort of, thing to receive and all that. And blood only lasts for 3 weeks. So
volatile. Yeah.
At the end of the day, if you're not giving a unit of blood in 3 weeks, then we can't use it anymore.
Yeah.
And the idea of, all of our communities coming together and donating blood, and actually us saying we're going to use this blood to save lives, to even throw one bag of blood away is something that is just,
a travesty.
We don't want it. We don't want to ever see that. And so, because it means a lot to us. You're giving a piece of yourself to save somebody. You don't want
So
to
how do they do that, Dr. Norris? Do they take the one that's do they cull through it and say, okay, this one's getting old, we should send this somewhere where it's going to get used today?
Yeah, absolutely. And that was one of the, and
how I buy milk.
Yeah. To plug St. Luke's, right? Of course I'm horribly biased because I work for St. Luke's, but I love what they've done. And I guess I'm a little biased because I was a big part of putting it together. But St. Luke's, actually, what we do is we only keep the blood on an ambulance for a week, and then we bring the blood back into like the emergency departments or just the hospitals.
Mhm.
And we, as an entire network, we will take that blood and we will take it to operating rooms. We take it to OB, we take it to general surgery, we take it to our trauma teams, and even our like medical ICUs and all that. Anybody who needs blood, we will see if we have all the expiration dates. We know it's going to expire soonest and all that. And we try to see if we can get it to all of those medical and surgical cases that might need a blood transfusion, and we use it up so we don't waste any.
Oh, that's amazing.
Wow.
Yeah.
All right. So switching gears, I love sports. So, and something I see a lot of and something that I'm proud has sort of gotten some attention. People, I think the NFL really put some spotlight on this when they looked at their neuro cases and looking at traumatic brain injury in the sports arena and just seeing like our young athletes and our professional athletes and kind of how this is impacting them.
Yeah, because it seems to be showing up. Similar injuries are showing up not only from like the history of the military medics and trauma care, but they're showing up in team and college athletes as well, especially traumatic brain injury or TBI.
Well, and I think it's important to understand that TBI, it's not just like a one-time concussion. You got knocked around a little bit.
Yeah.
This is a long-term effect injury. People have things mild like headaches that recur, but memory loss, personality changes, depression, and just other behavioral changes. And I think when we started recognizing stuff like that, there's increased risk of suicide in these patients.
Yeah.
I think people started saying like, okay, hold on, what are we doing around here? And
I feel like in the last like even 5 years, Ashley, it's really sort of gotten a lot of a spotlight on it. And it's not just football or boxing, the obvious ones, it's soccer's, cheerleading.
Yeah.
Cheerleading falls,
those girls are dangerous.
gymnastics, basketball collisions. I mean, we're not even going to mention the hockey. But we will.
That's because the Canadians haven't won anything. I mean,
But I mean, let's be real here, Mo. I mean, most of the American teams don't.
I'm sorry.
I feel like we need a flag.
Honey, you can keep trying to blot out the sun, but it isn't going to happen. All right.
Wow,
Just
okay.
saying that all of the American teams have a lot of Canadians on them. And now back to the podcast. If speed or gravity are involved, you're really kind of in the risk zone, Ashley.
Yeah. So I think, and I think it's really important that coaches accept this and comply with it and understand and realize that, it's a right now thing and the kid seems fine, but this happening over and over and over again, it's not okay. So, Dr. Norris, from the ER perspective, I know we see tons of this. Yeah. Kids come in to get evaluated and, when you send those kids out of there, because we're not admitting them for a concussion, what are you telling moms and dads and coaches and athletes? Like, what are they looking for? How long do they watch? When do they come back? What are you teaching them?
Yeah. So obviously we see a ton of concussions and we see it, correlating with when everybody's going in for sports. So it's a lot of sports injuries, but it doesn't necessarily have to be. And so we see, I would say, I don't think there's a week that goes by that I don't see at least one concussion.
Oh, really?
Yeah, absolutely. But a few years ago in 2019, they had a work group that sat down and really wanted to standardize some terminology and some like treatment algorithms and diagnostic sort of stuff. And they made a lot of recommendations. One of the things is they recommended that we get away from using the term concussion and you start using the term mild traumatic brain injuries, because all of these concussions really are traumatic brain injuries. Mm-hmm. The good news is traumatic brain injuries alone doesn't cause like mortality. Like people don't die of a concussion, but people do die from things that look like a concussion. And I'll use concussion just because it's easier to say. It's less words.
There you go.
But whether it's a mild or a severe concussion, or if you want to call it a traumatic brain injury, they really are a spectrum of kind of the same thing. What we really do see is if you have any symptoms of a concussion, then you have a concussion. It's a clinical diagnosis. There's not a test that I need to do. They've done some blood work, kind of investigating whether or not you could diagnose it with a few blood markers and all that. And they found that although there is a few things that you can actually find in a blood testing, it's not really necessary, and it's not very sensitive or specific. So there's a lot of times where people have concussions that it doesn't show up. A lot of people who will have those blood markers when they don't actually have a concussion. But the thing that I really want to, kind of stress to people is that concussions can occur with any head injury that you then have symptoms. So whether you lose consciousness or not, whether you vomit or not. But the things that I'm always worried about when it comes to concussions is if you have an extended period of unconsciousness,
Right.
not for a few seconds, but you're looking at like minutes, like half an hour, like something, that is concerning. And that is something that may be something more severe than even a concussion. If you have multiple episodes of vomiting, like if you vomit once, it happens, it's okay. If you vomit more than one time, I'm now concerned about, do you have a skull fracture? Do you have bleeding into the brain, intracranial hemorrhage? At that point, I do want to do some further investigation. But a lot of times, concussion patients, even if it's a serious concussion, we tell them like, it's okay for you to go home. This idea that you got to wake them up every half an hour or every 2 hours or whatever to make sure that they wake up. That's kind of old timey. We don't do that anymore because the idea was if they don't wake up, they could have an intracranial bleed, like they could be bleeding in their brain. And we're really finding that if we have a lot of scoring systems, we have the Canadian C-spine or the Canadian head CT rule, which is a fantastic, probably the best used rule when it comes to do they need imaging, do they need
A lot of head injuries up there.
A lot of head injuries. There's the hockey again, right? It's not just the teeth.
Okay.
Teeth in the head.
It's the rest of the head too. So they always throw their helmet down, and I'm like, keep it on.
It's when we throw our gloves down that's a problem.
That's the start. Okay, that's the bell. But what we tell people is, hey, if you have any sort of multiple episodes of vomiting, if your family member is becoming more confused, if they have any sort of like weakness on one side of their body, not if like, I just feel fatigued, I feel kind of foggy headed, but if it's like neurologically, I'm having some sort of new deficits, if they are essentially having any sort of like erratic behavior, or they are what we would actually talk about true lethargy. So not like, oh, they're a little sleepy, but like, no, this person is unable to be like stay awake unless they're being physically stimulated, those kinds of things. It's like, absolutely bring them back for sure. Cause we want to do further workup, but just to treat a concussion, what we really tell people is give yourself some brain rest, right? Like, so no, you don't go right back to sports. Like a return to sports immediately is a bad idea, especially same day. A lot of times we'll have people come in with a concussion from like, soccer or football practice or whatever. And the coach is like, hey, can he go back and keep playing? And the answer is no. Like the 2019 recommendations they put out said, absolutely not. They need some brain rest, right? And that brain rest usually is like sleep, decent, meals and all that. And then no return to physical activity until their symptoms are really resolving. And if they start doing some like light aerobic physical activity and their symptoms get worse again, which, the symptoms of concussion can be ongoing for even weeks, like 6 weeks or so. And, it's things like, changes in your appetite, not a whole lot of appetite, difficulty with sleeping, kind of that cloudy headed, foggy,
Right.
Brain fog, a lot of times people get recurrent headaches, and a lot of times those headaches are worse if you are watching a lot of backlit screens. So a lot of people that are using computers or cell phones or tablets or TV a lot, you'll actually notice that those make you have a worsening headache. People can have occasional vomiting. Like if you vomit once at home or so, that's not unheard of or unexpected. Even though that's kind of a dicey sort of, if you're vomiting a ton. Those are okay, and usually the symptoms will subside over a period of time. But we always tell them, I do want you to follow up with your primary care doctor because, you are going to want to be reevaluated to make sure that you are improving and that, you don't have, like one of my favorite words in medicine, recrudescence, right? So recrudescence is like when your symptoms get worse or come back. And I just think it sounds awesome.
That is a good word.
That's a good word. But you need to follow up with your primary care doctor. And if your symptoms aren't improving like as expected, then they're going to send you to a neurologist. So if you're a kid, it's going to be a pediatric neurologist. And again, to plug St. Luke's, we actually, we have a whole system set up to where if I have any patient that comes with a headache or with a concussion, we will send them to, we have a concussion clinic where we actually will have them follow up. And our concussion clinic will actually call the patient to make sure we don't get like lost to follow up. and they will actually call them, make an appointment to be seen by like the appropriate, like either pediatric neurology. We have
That's highly efficient.
I know, it's amazing. I love it. We have just regular neurologists. We have occupational health that takes care of people that had this as a part of our workers' comp, and then sports medicine for people that are like athlete-related injuries and all that. So, because that follow-up is so important, and return, is so important as well if things get bad.
Yeah. So I think something that we talked about before that we're both really intrigued by is there is research out there. And I don't know how strong it is, but it truly links TBI to criminalized behavior. And, it became this whole back and forth about, well, is it the chicken or the egg kind of thing? Because was this criminal behavior due to head injury over a long-term time, or was the head injury induced by the criminalistic risk behavior that this person has innately? So, I mean, what do you think about that? What do you think about that kind of correlation?
So, I would say it's kind of a Phineas Gage sort of thing. If you get hit in the head often enough, you're probably going to lose some of that, frontal lobe sort of decision-making sort of, behaviors. And I am kind of going out on a limb with some supposition, but we definitely do know that like repeat concussions. Oh, and that's the other thing is if you get a second concussion, that second hit sort of syndrome, it can actually significantly prolong or even make your symptoms semi-permanent when it comes to concussions. So we always say do not return to full contact sports until.
So you mean if you have a second injury before the brain has healed from the first, it exacerbates the recovery time.
Absolutely. And it can make it permanent. And we've seen that with boxers and football players, and they've made movies about the NFL and football players, really looking at the fact that repeated traumatic brain injuries, over and over and over again, can absolutely have some very permanent, very devastating sort of consequences. And depression and erratic behavior, psychosis even, which is obviously well associated with criminality, is really found frequently. So
it's probably more of a cocktail more than any, as any sort of
medicine.
It is though, right? It would be a lot of sociological influences that would just make it the perfect storm if you get that, if you get the third tap or the fourth tap or whatever, however many taps it takes to just sort of, make that new kind of vascular highway inside of the brain.
Yeah. I don't know how many head strikes it takes for me
to
lose everything, but I do know that each one is probably further down the scale.
Further
along. Chris no longer being a doctor.
Well, and I think too, we have sort of shifted all of our care and our paradigm to preventative care, preventative medicine. And I always tell people it's a lot easier to prevent and cheaper injury than it is to treat it and live with it. So sports, of course, but then I think we just need to start thinking about make your kids sit in their car seat, make them wear their seatbelts. Kids on bicycles should have on helmets.
Yeah.
And, it's walking across the street with your cell phone in your hand this, not a good plan. And that seems to just be adults, children, and elderly folks too.
Mm-hmm.
But I think just really getting campaigns out there. And I know there's a lot of programs with law enforcement agencies and stuff like that, where you guys work with kids for safety. And so I think as much as we can do to truly put it out there and make people realize it is actually a big deal to wear your seatbelt. It is a big deal to have a helmet on. It's important.
And my daughter, I've got a 17-year-old daughter, and she is the absolute world to me, and a 14-year-old son. You're great too. But she is always
way to throw that in.
Yeah, right.
This is mental health prevention.
Remember how we were talking about the stick tap earlier?
Yeah.
You just gave your son a stick tap.
Yeah, absolutely. But my daughter's always saying, in the big 2-5, are we really still doing this? Seriously? If you're not wearing your seatbelt in 2025, it's what are you doing? Come on. Grow up.
Yeah.
And even I always say to my kids, because now our cars are sophisticated and they're very freaking annoying if you don't put your seatbelt on.
Yeah.
I feel as though my kids leave their seatbelts off to see if I lose my shit with the beeping. They just wait for it. And they're like, you hear that? You hear that? And I'm like,
and do you lose your shit?
Yes, absolutely.
Yeah.
Frequently.
I know, I've seen it.
So, all right.
Allegedly.
Allegedly.
No,
But then I'm very
no,
nice.
I can empirically state I've seen her lose her shit.
Yeah.
Over very important things.
Absolutely.
okay.
Always important.
Always.
Yeah.
Okay.
No drama. I'm not dramatic.
Yeah, totally.
All right, so we're going to take a little break. We have a fun little video that we did before. Dawn, I sent it to you about which nurse are you. So we're not going to talk about which nurses we're killing and sleeping with this week. We're actually going to play a fun little reel and see
Oh, you
which
did Mary
nurse
Sleep
we
Kill?
want to be.
So you want the video and then the break?
Yeah.
Oh, okay.
And lead us right into break.
Thanks. Mom.
Perfect.
All right.
All right, it's time for a little code Lavender Chaos. Welcome to our Veterans Day special edition of Which Nurse Are You?
Because in every hospital, in every trauma bay, there's at least one of each of these nurses.
This nurse is practically deployed on the unit at all times. Tourniquet, already in their pocket. Flashlight, always on their badge reel. CPR, they start it before the patient even hits the mattress.
Their motto, if it bleeds, I can fix it. This nurse can size up a whole waiting room in for seconds. Chest pain, room 1, stubbed toe, sir, please have a seat. I Googled my symptoms. Straight to the maybe later pile.
Their superpower. Knowing when someone is truly sick versus when someone just wants a warm blanket and attention. This nurse moves with the precision of a military operation. Line in, vitals, done, labs, already sent. EKG, completed before anyone asked.
They treat every shift like a trauma drill. And honestly, we're all safer for it. This nurse clocked in thinking it was going to be slow, but now they're running a mass casualty level assignment.
They go from good morning, everyone, to I need a nap, a snack, and a therapist in exactly 12 minutes. This nurse connects with people instantly. They know the lingo, the humor, the culture, and the importance of respect.
They also somehow get the toughest patients to finally accept pain meds, turn over in bed, and drink water. It's a miracle every time. This nurse thinks they're on an episode of SEAL Team at all times. They yell copy that on shift report and roll up their sleeves like they're prepping for a covert mission.
Do they need to rappel from the ceiling to hang for fluids? No? Will they try? This nurse has walked the walk. Military training, real deployments, real sacrifice.
They bring leadership, calm in chaos, and a backbone made of steel. When things get wild, everyone looks to them.
So, which nurse are you today?
And if you're a mix of all 7, you're probably working the night shift.
The views and opinions expressed in this program are those of the speakers and do not necessarily reflect the views or positions of any entities they represent.
All right, so welcome back to Code Lavender. We're gonna have a little fun now. This is gonna be my favorite segment, and I'm just gonna call it Do's and Don'ts of the Emergency Room. Yes. Why should you actually come visit us? Why should you stay at home and never come?
That's
visit us?
interesting. But I think this is where things are going to get real. We've all seen some things. You just caught me telling one of my things. Actually, his name was Dr. Norris too.
Oh yeah.
Yeah, but
Okay.
he was an optometrist. Hi, Justin, if you're watching. Definitely has. We know Dr. Norris definitely has some stories too.
Yeah.
Yeah.
So, I mean, I have a list after almost 30 years in the ER, but Chris, what if you could speak to the world right now? Look at the camera and speak to the world.
Yeah.
What do you wish every patient who is coming to the emergency room, because we want to take care of you, what do you wish they knew?
Ooh.
Or a misperception, or like, what should these people hear from us?
Well, without upsetting people, because I love seeing everybody in the emergency department, and I'm glad that you guys come.
Stop
and see
it.
me.
Stop it.
Without what he
Stop
really
it.
means to say is without
But
prejudice.
that being said,
With all due
yeah,
respect.
with all due respect, if this problem has been ongoing for 6 months and it has not changed, or if you've seen 5 specialists for your problem and you can't get an answer, I promise you, today is not the day in the ER. Like, I am an ER doc. Most of what I do is I see, I see things and I say, okay, I either know what that is or I know somebody who probably doesn't know what that is, and you should go see them.
Yeah.
In reality, for chronic problems, it's like, yep, and this is going to be chronic as I send you home too, because I deal with emergencies. Like, so if your foot smells funny for 6 months, I probably am going to send you to a podiatrist. Like,
Bathhouse.
yeah.
Yeah.
A bathhouse.
Wash yourself.
Well, not.
Wait,
Of course.
Wow.
Not that.
Wow,
kind of a
that got
bathhouse.
deep.
Oh wow.
They don't
That-
help with
Anything
your
you wanna-
feet.
That
Actually,
turned left really fast,
Right?
didn't it, Ashley?
I was gonna see
You
if
gotta
you want to
pay
go
extra
get a
for that.
Korean body scrub.
Oh my God. I've had those. They're
Me
wonderful.
too. Me too.
Mm.
Yeah, it was so crazy because they put that towel over your face,
In
right?
front of everybody else that's unclothed.
Yeah, no, but they put these like cotton underwear on you, but they put a towel over your face, and then they start like rub,
Scrub the shit out of it.
right? And then stop it, and then so they say, don't lift the towel,
Have you
don't lift
guys
the
heard
towel.
about the cum tree?
And then so
We sat under the cum tree
I-
together in harmony.
Wait, what?
I believe it might be on our Code Lavender coffee
It
mug
is.
if you can
I
get
think
this
it's
in
good
here.
for your hair.
Oh, thank God. Zoom in.
nobody wants to hear the story. Okay, that's fine.
They were scrubbing the shit out of your face.
No, my body actually.
Yeah, but
And
they
so
don't
they
want you
said-
to look at them while they do it.
They say don't look,
Yeah,
right?
don't
But so
look.
I lifted the towel and I looked, and I was like, I went with my friend whose name is Beatrice, and I go, oh my fucking God, I gotta know what kind of scrub they use. It's like rice stuff, and she's like, that's not rice, that's your skin.
Oh,
Oh, Jesus. Yikes.
Yikes.
That's some dry skin.
Mm.
Yeah, that is some deep
Oh, look.
exfoliation.
Sorry, but that's Irish girls don't have good skin. That's the way it goes. Okay. Took a little diversion down Tanya Lane there. Okay, so Dr. Norris, what is the best way for families to help rather than hinder when we bring somebody into the ER?
Oh, I mean, families actually can be really helpful, and a lot of times, if the patient is somebody who's elderly and maybe has some dementia or little kids and all that, family are just invaluable. With getting history and knowing what your medications are, and,
Timing.
yeah, and knowing whether like Gramps drinks a handle of whiskey a night or
Yeah.
whatnot. But I think a lot
Wait,
of
that's bad.
no, it's just something we should be aware
Wait,
of.
All right, thank you.
Chris,
Look,
we're
we
gonna
don't
play a
judge.
game.
Mo, we don't judge.
We're gonna
Thank
actually
you.
play a game.
Mhm.
Chris, guess Mo's cholesterol.
Oh God.
Do it.
Oh, well, you'll have to come out. I'll have to take a look.
All right,
at your
hold on.
body habits.
You can look at his body and know what his cholesterol is.
Hold on. I
Listen,
stand by.
No, I can make a wildly uneducated
Okay,
guess.
make
Do
a
it.
wildly
I'm dying.
uneducated guess. All right.
Like 230.
Oh my God.
Well, actually, the last test I had, I was 268.
Okay. All right. I'll take it.
And he came down.
It's Price is Right rules.
That's my triglycerides.
He came down.
But you've been working at it.
He
All right.
has been. He has
He
been.
has.
Yeah, because like he really scared me when he told me the first.
338.
That is awful.
Yeah.
Yeah.
So, what was it like to just have like goo going through your veins? Like,
Well,
how many
let's not
hamburgers a
open
day?
that can of nuts.
Nuts.
The sad part is I'm actually working at it. The doc called in. He called in meds for me, 10 milligrams of something, but
Atorvastatin.
Atorvastatin.
Yes.
No
what
grape.
was say
There
it
you go.
again?
No grape.
Atorvastatin.
No
Lisinopril.
grapefruit juice for you.
Yeah, something, but whatever it was, I'm trying. Like I'm trying to get
Well,
my cardio back up, and
I love
Yeah.
that. Remember, progress
You
is
are.
perfection. So
you
if
told
you're,
me I'm walking every single day. And I'm
I
like, that
am.
is
Yes.
awesome.
I
Yeah.
am.
if
Yeah.
you're moving in the right direction, you're doing perfect progress. Right?
Yeah.
God love you.
Oh.
I mean,
He
ways
just turned 50 and he was absolutely certain he wasn't going to.
That is true.
Well, there you
as
go.
well.
Yeah.
Surprise.
Very good.
I think ways in which I've seen family that have really kind of
yeah.
hindered things is, I think probably one of the most tragic ones is when people are like, well, I know that grandpa has a D in our DNI, but we love him so much we just can't stand to let him go. We want you to do everything.
Oh,
And that
God.
puts us in a really awkward situation where it's like, do we violate this, this order, this, legal document that this person has put into place because they don't want this, simply because the families wish it. It puts us in a terrible situation.
Yeah.
Or, get your vaccinations. That's all I'm going to say. Get
Yeah.
your kids vaccinated for the love of God. There's enormous amounts of evidence showing that it's fantastic. The benefits far outweigh the risks. I think that probably one of the biggest hindrances I see is when parents choose to put their kids in harm's way because maybe some uneducated decisions they've made.
I think that's a sign of the times.
It is. Oh, so
Yeah.
much.
Yeah. Yeah.
And when we look at new nurses, we're seeing new nurses in specialty areas like the ER because of our shortages. And it's, this is uncharted territory. We did not allow this before. So I know that you as a physician do support nursing staff a lot. You don't
Heck
just
yeah.
support your residents. So what do you think is a rookie mistake that you see out of a new ER nurse or even a resident whose July 1st day comes around, or your medics, that just makes you hit the pause button and be like, yo, do not ever do that. And I'm going to tell you why.
I won't name names, but I will just say that I don't know what part of the nursing curriculum is involved in not crushing up Percocet and putting it into a central line, but don't do that. Not a good choice.
See, I look here and go, I actually wouldn't do that.
Yeah,
So,
thank God. That's
no,
why.
can't
No,
say
I
that
would
I
never
wouldn't
dream
either.
that was a good idea.
Yep, that didn't pass the muster in at least one circumstance.
Wow.
Wait, I have a good story. A young nurse took some ketamine home in her pocket.
Oh, God.
Complete
Yeah.
mistake.
Mm.
Worked the night shift, fine. They of course do the count in the morning. They can't find it, and so they call her. And I guess she lived a little ways from the facility. And they said, no, it's ketamine. You got to bring it back like right now.
Mm-hmm.
She sent it with an Uber courier.
No.
Yeah, I love that.
I
No.
loved
just,
it.
No.
I loved
Oh,
it.
Jesus.
And
No.
so she did get fired
Yeah, I
when
can
she
imagine.
would have never gotten fired. And I'm like, I'm
Mhm.
just impressed that the Uber driver didn't say, oh, ketamine, and go sell it somewhere. So
Or
he's
like
a good guy. So shout out
injected
to you,
into
ketamine returning
ingest
Uber
it.
driver.
Yeah.
injected into a water ball. I read about that today. That
Hypothetically.
they're
Into a
saying
what?
that this is a
Oh,
danger
into the
for.
water bottles.
Yeah, they're like if you get into one of these car service things, that you should be wary of accepting
Yeah, they don't take their water.
their waters and
Yeah.
whatnot because they're. But then again, I saw one of a guy that was driving some kind of a car. So actually, I think this might have been a yellow cab, and he pulled over and he shit on the side of the road.
They're done.
She videoed the whole fucking thing. I swear to God, I'll send it to you. I will.
I watched a very interesting video on
She's like, she was
Instagram.
like razzing his ass too. She's like, I can't believe that you did this and you pulled me. You took this ride. And blah 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 blah. Oh my
Man's got
God,
shit.
I'm dying laughing at this.
And I think, my message to the folks out there is we do want to take care of you and we're going to see you.
Yeah.
But the 28 people actually dying here, they're going to get seen before you.
Yeah.
So, that was,
Dawn,
I
get
was
under the table.
often.
Get-
What's going on down
Get
there?
under the table, Dawn.
They muted you. They cut you off.
Yeah.
Oh my God, I have been silenced.
No,
Oh, wait.
there you go. Hey,
Never.
we're back.
No,
I'll
that-
share my
no.
microphone with you.
There you go.
They-
No, you're right. And
Hello.
getting back to kind of the whole triage thing, if you're waiting
Thank you.
forever to be seen by a doctor in the ER,
I
I
think
know
it's
that it's
good.
kind of cliche and there's been plenty of memes now that have come out about it, but it's like, hey, listen, we try to take care of the sickest people first. So if you've been waiting a little while, it probably means that there's some really sick people that needed to be seen ahead of you. So have a little compassion,
Yes.
we're doing the best we
Yep.
can. And I don't care what ER you're in. We have weights. Everybody is in,
Yeah.
in the waiting room. We're overburdened with, healthcare and all that. And with a lot of people losing their insurance and a lot of things like that, like wait times are getting to be longer. More
Yeah.
people are in our waiting rooms. And it's like, have some grace. We're doing the best we can. We're people too. Like we go home and we have families. And if you're waiting, I'm sorry. We're trying. We'll get to you as soon as we can. And, the person in cardiac arrest or the person that has a collapsed lung is in, fluid respiratory failure, the person who, just got shot, like they need to be seen first.
Yeah, and I mean, read the room.
Yeah,
You're going to
Seriously,
see it
read the
coming.
room.
No, I mean, I went in there with a UTI once in Jersey City.
That's a
And-
great story.
Oh,
Well,
God.
except when I was in the ER and everybody was worried about the food trucks that were outside because it was like a celebrate Nurses Day and they were all talking to each other like, yo, did you get outside and get the taco truck yet? Like, go outside. It's awesome right now. And I'm like, yo, I might be dying here right now. I'm sorry.
But
There
were
are
you?
people
But
who
were
can
you?
talk
I
are not dying.
wasn't
did you
I wasn't
die?
dying.
Did you
Please.
die?
But did you die?
No, but I did not die.
Hey.
Please,
Well, nor
please,
did I, but I
please-
could, like, the point.
please go with your
Good job.
UTI
The
story. I'm
moral
sorry.
of the story is that I could see people coming in who had gunshot wounds and children who had gotten into their parents'
So wait,
medication.
you went to the ER for a UTI?
Yeah, because like I
Seriously.
kind of had no. That's
I mean,
shut up,
I-
shut up.
If it wasn't 3 a.m. and there was an urgent care that was open.
No,
I'll save you a
it was
couple
like
bucks.
7 o'clock at night, and the walk-in sent me there.
The walk-in sent you to the ER.
Yes. No. I'm not being an
Thanks,
asshole.
Surgeon.
This
what the
is
hell
for,
kind of UTI?
yeah, like I had a pretty bad. It was pyelonephritis.
Okay,
Yeah, no,
pyelonephritis.
it
It was
was
a who to
bad.
what?
It had gotten. It went.
It traveled up
It
the
went
tract
rogue.
into the
Into
upper,
the kidneys.
and she needed IV antibiotics.
Yeah, no,
need-
because they
You
can't.
do
They
not need
can't.
IV antibiotics for that. We send people
Shut
home
up!
with
I'm
two
trying to
weeks
make.
of
I am legitimizing my friend.
Look, I had a fever. Okay.
I'm reclaiming my
okay.
time.
Yeah.
Oh, well,
I
poor
needed
you.
fluids.
Poor you.
Absolutely. Here,
I didn't complain.
It's allotted.
you could have taken the
My
Uber driver's
vagina
bottle
was
of
on
water.
fire.
You needed some
Well, my
fluids.
pain was a 10.
Oh please!
On the
All right.
smiley
What's that
face
say?
scale,
As she's on the
please
cell phone.
rate your
From a
pain.
1 to 10. I want to do a
My
middle
vagina was
finger
on
like
fire.
wind for pain scales. This is going to be my next publication. I'm going to do
Oh,
the
that's
middle
a good
finger
one.
pain scale. A little bit for 1,
Love
little
it.
3. Yeah, because like if I'm in pain, I want a middle finger, not a fucking smiling yellow circle.
Well,
Yeah.
you've seen the
poop
modified
scale.
No, not the
Oh,
poop
no, I've
scale.
seen the poop
Although,
scale.
yeah, there is a poop scale.
I showed
Oh,
my
I've
class
seen
the
the
poop
modified
scale
poop
today.
Yeah,
scale.
the modified poop scale. But no, have you seen the modified pain scale where it's like, ninjas, bees?
Yeah, that's for
bees?
kids. I want middle fingers.
No,
for
this is,
adults.
like mauled by a bear with your arms torn off. Like, like
That's how my vagina felt
Yeah.
when I had my UTI.
It's
Yeah.
not your
Impaled by my
vagina. Oh my
wife.
God, Mo. This was in my kidneys. This was very serious. I'll have you know.
All right. So, what's the weirdest, most unforgettable story or patient you've seen? Of course, while protecting HIPAA,
while
we have to be
protecting
very
HIPAA, we're
careful.
Protecting HIPAA, that's right.
And we
The
do have
weirdest.
respect for that. But what's the
course.
weirdest thing or
Oh, well.
I could think of 10 off the
If
top.
you don't use names and
I had
HIPAA's
a patient
perfectly
who-
okay.
Come on, Chris. Give me a good
He-
one.
He or she.
Did you
He
have
or
somebody
she.
that had a UTI that felt like their arm was being ripped off
No,
by a
that's-
bear?
That's just a Tuesday.
Got it.
It was a
So
Friday.
I did have a guy who systematically took apart and ate his entire CPAP machine.
wow.
Ate the whole thing,
Did he put ketchup on
piece
it?
by piece.
What's that called?
Pica.
Pica. Very good. Yeah. Pica. Very good. Yeah.
Wait,
Oh, good. I've
what?
taught her
That is not
pica,
the only thing
eating
he's
non-food sources,
Yeah.
but it's usually organically driven.
He's eaten a whole pair of, well, now this is getting to be too much, but
Is he a second
Dirt.
patient?
Was he a dirt? Did he eat dirt? Hair?
No.
Fingernails?
A pair of glasses.
What?
Oh.
Really?
What?
Oh my God. I love that.
An entire shirt.
Jesus Christ, it's Jason Bourne.
Yeah, God love him. He's kind of a local legend. I apologize.
But a
Maybe
whole,
not.
like a CPAP or a
Whole thing.
BPAP? Come on, Dr. Norris.
CPAP.
Okay. Well, come on now.
Jesus.
Bring back the big stories next time, okay? Come on
when you're
now.
serious. Yeah.
I had a patient come in. Actually, the police brought the husband, and he had a knife sticking out of the side of his face. That was kind of cool. And
Yeah.
Jesus.
he was just silent. And I'm like, oh no, this guy's in shock, and this is going to go. And they waiting roomed him, of course. So I'm like,
With a knife in his head?
there's a knife in his
Jersey,
head. And there's
was it
small
Jersey
children.
City?
No, it was worse. And so me being the triage girl I am, because I do adults and kids, I'm like, there are children looking at like the Halloween creature.
Yeah.
So I take him back to trauma, and
thank
now
God.
his wife is there, and she's
She's
like,
She
got a
put the
knife.
knife.
She put the knife there. Yep, 100%.
She
She's
surely
like,
did.
he's fine. Let him walk it off.
So she did. She put the knife in the side of his face, and we're seeing
Oh,
her
shit.
for like psych evaluation, obviously.
Yeah.
And she's like wild. But I'm like, sir, like, are you okay? And he's kind of in sight of her, and you know me, I'm like the lavender person, the whisperer. He's like, she
He's like,
slit
"Does
my
it hurt?"
dog's throat.
Oh my God.
And I'm like,
Jesus.
with what? And he's like, well, it wasn't this knife.
Oh my God.
This knife's been there for days.
But that guy, I'll never forget him, because he
I can
just
imagine.
sat and talked to me with the knife in the side of his face. Like it was like everyday business.
How big was this knife?
It was nice. It was like a Sachoko. It
Nice.
was like a Japanese
Jesus.
chalk knife. It was good.
Yeah, he was probably talking to you all calm because he didn't have a frontal lobe anymore.
Well, that's all right. No, he missed his dog.
Well, that would make anybody sad.
But
And
he
John
was
Wick?
stabbed
very
in the
bizarre.
temple by your wife.
Jesus.
Yeah. And
Yeah,
I'm like
John Wick.
advocating for
Yeah.
murder charges with the police. And I'm like, they're like, we don't arrest people for killing dogs, but you should.
100%.
I mean, that
should.
seems weird. I feel like that should be
It
you
should be a
should get
thing.
some sort of
You should go to
consequence for
jail.
that.
Well,
Straight to
I
jail.
mean, maybe they're going to call the other agency like that the EMTs are under. What was it like?
The
Farming
Department
and
of
Department of
Transportation.
Travel.
Oh, yeah, the Department of Transportation.
Well, maybe that's who arrests them then.
Yeah.
People that are
yeah,
mean
absolutely.
against animals. I
And they
don't know.
take-
Oh,
away
yeah,
in an
like the,
ambulance,
what
yeah.
is it? The Department of, who actually takes care of that? That's the Department of,
The ASPCA.
Mo?
the ASPCA, absolutely.
Yes. I don't know if they're Department of
Animal
anything,
Cops.
but-
I've seen that. Good show.
Wait, what? The wildlife police.
Yeah,
What are
Sarah
those-
McLaughlin will come
what
to
are
your
those
house.
guys
right,
called?
exactly.
The forest police. I dated one of them from the
Forest
city.
Service?
What the
The
hell was
forest police?
Oh,
the
Parks and
United-
Recreation?
Parks and
No,
Recreation.
there's like a division of cops in New York City, but they're federal cops and they only do the
Oh,
parks.
The New
Forest
York
like
Division of
Services.
Governor's
Federal
No,
Forest
Island.
no.
And what's
You
the-
know, you do
the
know.
park police, the
The
United
National
States
Park
Park
Yeah,
Police.
you do know. Yeah, you do know.
Who?
Yeah, they gave Bruce Springsteen a ticket for doing a shot down on Jersey
Yes,
Shore
the
with
United States Park Police.
those
That's what
park
they're called.
police guys. Yeah, yeah. Totally.
They're like the guys who can't hack the real job.
Oh, dude.
That was
Oh.
so
Right.
not nice. I just
Mom.
dated one of them. Time out. I dated
Wow.
one of them. That really isn't about
Wow.
the job. It's about him.
So
Wow.
you're, yeah,
I'm gonna let that
So
go.
disparaging
Wow.
comments. That's fine.
They
We get
ate
that.
both the red and the blue crayons, baby. They had to send them to the Parks and
Wow.
Rec.
Yeah, they were in a
Well,
race.
Bruce
with,
Springsteen's a piece of shit anyway. So I mean,
Come on
hypothetically-
now.
Oh, man,
Come
you say
on.
that here in
Come
Jersey,
on.
man. That's fighting words in Jersey.
Yeah, really.
Yikes.
Where aren't we in
Sure.
Pennsylvania?
We are not in Pennsylvania. We are
We're-
in
we're
this
close.
is P-Bird. Here we are.
I love
What-
it here.
You love it here?
I
in
like it
P-Bird?
here.
I love it in this area.
Oh,
actually.
well, me
Yeah.
too. That I'm
Yeah?
here. Yeah. That's why I moved
All
here.
right. I think we've expired for today.
Well, thank you. for
We've
having
covered
me.
a lot of ground.
Yeah.
We've shared some laughs. We've shared some tears.
Have we?
We brought back the cum tree.
We
had
brought
to
back
bring
the
it
cum
back.
tree.
Look, it never went away.
We've established that Bruce Springsteen is a piece of shit.
No, we
Um,
didn't.
No, we didn't.
That's allegory.
there's-
Not stand
there's
behind
the-
that view.
The cum tree.
Me either.
The park police. All right. So we have a couple things we do want to talk about and plug, put
Go.
out there.
Yes, please.
Wait, we need a new plug graphic. Get it up there.
Oh, nice.
Oh, wait, hold on. We have a plug graphic?
It's
Hold
in
on.
there.
Do it's
wait, go up.
tie-dyed.
It's got the gradient up, 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 up.
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 Wait,
So-
right there.
This?
Yep.
There it is.
Ah.
All right. Yeah.
So we are shouting out all the brands and the people and the organizations and projects that we love. And I think it would be remiss of us if we don't start with the Brothers Before Others and take a look at their flower fund and kind of tell us a little bit about what they do. And I know Mike set up a page. I loved it, on his Facebook page, where he was taking donations in honor of his birthday, and he's going to put towards the Brothers Before Others. Power
Don't
Fund.
plug.
Well, you know,
his-
he's
Plugging
down.
Mike.
Listen,
don't plug his birthday.
given his birthday, I know that he
Oh,
is hanging out at the senior center a
God.
lot
He
lately.
is at the senior currently.
currently.
Oh,
So
God.
I think you guys can kind of like do the math and figure out exactly the connection
How old
there.
is Mike?
Senior center, he's old.
He really is.
No, he's look, if he's older than
Well,
me,
listen. All right, you guys go first, and then I'll go. Go ahead.
okay.
No.
Go ahead.
Dr. Ashley, you
What
had
else do we have
something.
n- What else, are
No,
we done
you-
with Mike's
the
birthday?
Wizards?
No, I would do your thing first, and then
Okay.
I'll
All
go on Mike's
right.
on Mike on BBO and the Flower Fund and Mike and
Okay.
all
All
that.
right. So I think our spotlight for today, and this one's really home, hits the heart. We are going to plug the legendary, iconic Harlem Wizards.
Woohoo!
Yeah.
Listen, if you've never been to a Harlem Wizards event, imagine a basketball game mixed with comedy, dance, trick shots, glow in the dark, drinks, and enough energy to keep the whole stadium just screaming.
But I think like the real magic about the Harlem Wizards is, I think we have all seen the Globetrotters, but it's
Yeah.
more than that. This is about kids and school and community, and they're partnering with organizations, school PTOs, things like that. And they are raising money across the nation to fund sports programs and school initiatives, equipment. They use a lot of the money to put towards learning initiatives for students in districts.
Oh, it's just so much good stuff. I love that their goal is just so simple, to make kids smile. I mean, and make communities stronger and help schools thrive. And they do it while putting on one of the most entertaining, family-friendly shows that you will ever see.
Yeah, so I think, we do a lot of work to talk about organizations and supporting them and what they're doing in our communities and how they, spread good in the world we live
Yeah.
in. And I was enamored when I learned they have raised millions of dollars for schools and nonprofit organizations.
That's just
So
incredible.
it's really, really
Yeah, I mean, if you're a parent, a coach, a teacher, a PTA hero, or if you run fundraisers for community, this is your sign. You want to book the Harlem Wizards for your next fundraiser or school event.
Yeah, and they make the process really easy. They're professional, they're honest. I watch them in action a lot. They are like flawless. They come in, they set up, and they have different programs too. They'll do a one-night event. They'll do like some stuff with your kids in your school. So it makes it easy. The parents have a great time. The kids are obviously just taken away by it.
Oh my
but
God!
it's
Just
really cool.
it's a
so
transformation
cool.
from when
And
they
it's
walk in.
successful. Yeah.
Yeah, you've seen it your firsthand. Like they
Yeah.
walk in one way, and they like by the time you're 10 minutes in, they're just like,
Yeah.
just going crazy.
Crazy.
Oh, it's awesome. So if you want to learn more or bring the Wizards to your school, visit harlemwizards.com or check them out on Instagram at Harlem Wizards.
Yeah, so support the fun they do, the community they've built, their kids they're helping, and just the organizers in these school districts who are really working hard to coordinate and give back to their own kids and, whatever. So I am shouting you out, Harlem Wizards. I love what you do.
Yeah, it's
We have a very cool video, I think, just a quick trailer that they sent me from YouTube that I thought was really, really cool. Just kind of highlighting, because I play basketball. They are freaking talented.
yeah.
We can't download from
We can't
YouTube, but I did share the
download.
link.
Oh my goodness.
I shared the link in comments though.
But yeah, they do some pretty awesome. I actually have video on my phone, but whatever, we'll show it some other time. They have really good dunk tricks, and
Good
these
job,
little kids
Dawn.
love it.
Good job,
They
Dawn.
don't let you download it.
Dawn, you had one job. You
It's a YouTube thing. They don't let you download it.
no, all right. Well, no. All right,
But
Blaine.
I'm
Yeah.
saying, no, wait, nobody can download our content either. So there you go. There's that.
All right, fair.
So,
All right,
go
good point.
Wizards. All right.
Dr. Norris, anything to
To
share
plug,
with
you know,
us.
I think the only thing that I would say is for my EMS agencies, St. Luke's Emergency Transport Services, Freedom Valley Medical Response down in Harleysville and Limerick, or any of the other EMS agencies in the area, thank you for all that you guys do. And for all of my nurses in the emergency department, and all of my nurses that work for our critical care transports, our flight nurses and all that, like I appreciate everything that you do so much. I could not do what I do without all of you, so like you guys you are the backbone, you are the meat and potatoes of all of those agencies. So thank you. Thank you.
Oh, it's amazing. It's all fingers on a hand, Dr. Norris. It is.
I don't know which finger I get to be, but
I know which one I am.
Oh boy, jeez.
Well, and I think just
Well,
wow.
thank you everybody for doing it.
On that note, you want to stay tuned for our December Christmas show.
Oh,
Oh,
wait, what?
Oh,
Say what?
we're doing a little Christmas episode next.
You are.
Not
we,
today.
We have no plan.
We do. She hasn't read this.
We have a plan.
Yeah.
Oh, we have a plan. We have a plan.
Wait, you do have a plan.
Yes,
What is the plan?
it's a secret.
No,
Oh,
it's
it's a
not a
secret
secret. It's in Google Docs. It's no secret. It's
We have Google Docs. It's not public.
yeah, you and I. Never mind.
Oh, and all kidding aside, happy Veterans Day.
Oh,
Sincerely.
Yes,
thank you to all.
For
Remembrance
100%.
Day. Yes.
anybody who is serving now, who has served in the past, sincerely, happy Veterans
Thank
Day.
you.
absolutely. Thank
I
you.
have freedom because of you, and I appreciate you.
100%. We have some crazy Marines downstairs still, I think.
Yeah.
Yeah. No, they won't be going home for a while. Happy Veterans Day, 100%. Blue, anything?
No, I've got nothing. But if you talk about BBO, the fundraiser he wanted
Yeah.
to
Yeah.
talk about.
You could have
Please
done that.
do.
Happy birthday, Mike.
Happy birthday.
Happy birthday, Mike.
60th birthday, Mike.
Mm.
No, honestly, the flower fund that BBO does, it's one of one. There is no other organization in the country that does what he dreamed up in his head. And we send a floral arrangement to every line of duty death services, and no matter where it happens in the country. And again, we get spoiled in the area that we're at, where there's so much family and there's so many members of service that show up for these funerals. You go to some of these smaller departments in the middle of nowhere. Our floral arrangements are one of two.
Wow.
And to hear from these families, again, that it hits different. It hits different, where they don't understand. Because again, as somebody that actually works as a cop, we understand the job. The family doesn't understand it. They might not even agree with it. They don't get on board. But to see that somebody's thinking about them when they don't even they see these floral arrangements and they don't have any idea where they're coming from, and we don't know their them. It just hits different. So yeah, and that all came up in Mike's head, and he's a lunatic.
Yeah. So happy birthday, Mike.
Yeah, happy birthday. Happy
It's a great
birthday, Mike.
cause.
And if somebody wanted to contribute to the flower fund, what's the best way?
brothersbeforeothers.org.
And I also have the link in the comments that he shared for his the fundraiser for his birthday.
Yeah.
But I believe that's only for a couple more days.
He shared a link for his birthday.
He did. That's
Yeah,
how I knew about it. I mean, I always see the
It's
flower
kind of
funds, but-
narcissistic.
No.
Well, no.
no,
it's
no,
to
no.
donate.
It's
To
for
donate to the fundraiser.
Yeah.
Mm,
Yeah. Yeah.
mm.
So open your wallets, everybody. Come on. $10.
It's not. It's not narcissistic.
I mean,
No,
Maybe.
I know
I mean-
narcissistic when I see it.
All right. So we will see you next month.
Yeah.
for
December.
really fun
where you
holiday
have something
show.
planned.
We have
do.
lots planned. It's going to be good. Yeah.
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 Code Lavender.
Go team.
Rah, rah.